Hello out there in television land, and welcome to yet another edition of It's Your Health. Philip Benyo with Philip Benyo. We're down at our surgical suite in our office, bringing you the latest and greatest in medical healthcare news. Make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. We'll be right back. Welcome back to the first segment of It's Your Health. This is the fastest 30 minutes in television history, and we're going to prove it right now. Right, Fipster?
All right, let's get into some headlines.
Okay, do it.
Pleasantries.
Okay.
Skipping meds may up heart patients' stroke risk. They've actually had to study this that found that if you are not good about taking your blood pressure pills or cholesterol pills, you might have a stroke.
That is amazing, and compliance is, of course, an issue, and we're asking patients to take medications for which they may not have any immediate issues. So why take a pill if you're not having an issue that may cause potential side effects? So it's pretty easy to skip it. But compliance is a problem, and it's up to families and friends to sort of goad our patients into saying, did you take your pills today, or set up a way of making sure that they take their medications correctly. It is important.
Moving on. Banned stimulant found in U.S. dietary supplements. The stimulant oxaliferin, which is also known as methylphenephrine, which is a derivative of ephedrine, this was banned, I think, back in the 90s. They're actually seeing these in supplements that are being sold as dietary supplements.
I just never understood this, why you would want to take a dietary supplement, particularly as a stimulant. I mean, you're asking to increase your pulse, your blood pressure, drug side effects. I mean, I think if you just get back to basics of good, clean living and getting proper sleep, you're not going to need these things. I'm not sure why we have to do it.
There's a huge market. These supplements can be marketed without any FDA approval. No one's checking to see what's in these things. So when really an independent agency says, well, let's see what's in a couple of these things, they're finding that, this medication, methylphenephrine, was banned for a reason. I mean, it was killing people. Back in the 90s, they banned it. And so, of course, that's going to work because it has a substance in it that'll help you lose weight. Unfortunately, it's not safe at all.
It's not safe. And I think it goes to that concept in society, Phil, where they think there's a pill for every ill. But some of the pills can cause ills.
That's right. All right, I get a lot of questions about fish oils and the different things that we can do, and I thought it would be helpful to go over some of the different things that fish oils or the omega-3 fatty acids, specifically omega-3s. Not so much fish oil because there's other ways we can get it, but let's talk about some of the health benefits of fish oils.
Well, I'm a big proponent of the fish oils. I think one of the reasons I don't have many wrinkles is because I take fish oils. It's not because of my wife, it's my fish oils.
She's right there. You can't say that now.
Just can't say that. But seriously, it has been shown to lower inflammatory factors, C-reactive protein, for example. And there's no question in my mind that the fish oils are your most potent anti-inflammatories. They're probably your safest ones, particularly if you're on other medications, although you got to be careful about blood thinners because they can interact with those. On days when I skip a fish oil, I know it because my back hurts and I feel older than I am. So I'm a big proponent of them. I think they are God's gift.
That's, I guess, well stated. Here's a little list of a couple of different things that we've been able to show that they help treat. They can certainly help lower your triglycerides. They can help lower inflammation in joints. This is the reason I take them myself, because my elbows and wrists will sometimes bother me. They've actually been able to show they're extremely important in baby health development and fetal development, so it's important that women who are even of the childbearing age who are thinking about even having a child, they really should be taking a prenatal vitamin that is packed with fish oil. And if you look at the good ones, they really are packed with it. They've actually had some studies that recently showed that it helps decrease asthma symptoms, but we have to look into that further. Even ADHD in kids, which I'm looking forward to read about. And certainly, as well evidenced on this network, it does help treat dry eye.
The the interesting thing is, I'm all for trying to get them naturally, but how much salmon can you eat? You have to be careful of the heavy metals in things such as salmon. But I think the biggest problem that we run into, Phil, and you may see this, is that people take fish oils that are the garbage of other fish oil metabolism. That is to say, they go to a discount store and get a bottle of 100 fish oils for $5. And those are what the pharmaceutically graded fish oil companies throw out, and they don't work. And you get the fish burn from them. So you get what you pay for. And I think if you were really looking towards good health, you're just going to have to pay a little extra for a quality, pharmaceutically graded and distilled fish oil. Is that right?
Yeah, I agree with that. Let's move on.
Okay.
This is a really neat headline that I really got a kick out of, that the shingles rise might be linked. You've seen a lot more shingles lately, haven't you?
No doubt.
Just in general over the last... When I first started working 14 years ago, I'd see shingles like once or twice a year.
I would call you in to see these.
Yeah, I was like, whoa, look at this. It's
Yeah.
like it is in the book. But now we see shingles, when it goes through its phases, we see dozens of cases each year, sometimes dozens a month. And what's interesting is that the rise in shingles cases corresponds with the increase in using chickenpox vaccine for children.
Now, how does that figure out?
Well, they don't know. That's
Okay.
what's really neat. They are linked. There's an absolute link there. Now, there's a lot of different theories, and certainly adults were using chickenpox vaccine now in the form of Zostavax to prevent shingles. The one interesting theory is, and I think it kind of makes sense, is that because we've done such a great job of eliminating chickenpox for kids, we've also eliminated a circulating virus.
Yeah.
Which, somebody who's a parent who comes in with a kid who has chickenpox and you're going to see them today for their cold, you're going to get exposed to that chickenpox virus just a little bit, and it may actually help bolster your immunity and therefore help keep your immunity strong when it's time to get shingles. Whereas now you're getting no exposure. So I think what I extract from this is the importance of the Zostavax vaccine.
Absolutely.
So if you're over the age of 60, you need to be talking to your healthcare provider about getting the shingles or Zostavax vaccine to help prevent it. Because the shingles, the older you are, if you get it, and the more likely you're going to get it now that we're seeing, it will change your life. It is very painful.
It is, and I've actually had a couple of patients who said, I want to put a gun to my head because of the neuropathy associated with it. And insurance companies have recognized this and have now lowered the resistance towards paying for this vaccine. So it's out there, you should get it.
Yeah, pretty much if you're 60 and over, you can get it covered, sans a deductible or something like that.
Right.
Moving on, lastly, let's talk very quickly, if we can, about the Mediterranean diet. The Mediterranean diet, as you know, is a diet that is rich in poultry, fish, healthy grains, things that are high in fish oil, really high fruits and vegetables, but the elimination of red meat. And so they actually looked at this, they reviewed the Mediterranean diet for long-term weight loss versus other diets, and they really found that the Mediterranean diet is a superior diet and not only helps long-term weight loss, but also has a lot of other cardiovascular benefits as well.
There's no question it's a healthful thing. I myself, when we come into the next segment, am going to give you my take on the wheat belly diet, which is a little bit different than the Mediterranean diet. So we'll be right back after this brief commercial message. You're going to want to stay tuned for the next segment of It's Your Health. Remember, you're watching your leader in healthcare information. We'll be right back. To the second segment of It's Your Health. Philip Benyo with the Fipster here, and I'm going to tell you a little bit about my Lenten sacrifice. Get a load of this. Now, for those millennia out there that don't know what Lent is, it's a 6-week period of solemnness that starts at Ash Wednesday, and of course you don't know when that is either, ends around Easter, And it's a period of time for self-denial and penance and things. So what did I do? I gave up wheat and wheat products. No pasta, no bread, and no exercise. And lost 10 pounds in the process. And I really, really, really believe that this concept of the genetically modified grains are poisoning our society. It's making our country wider. You want to lose weight, you kiss bread products, wheat products, and pasta goodbye. And there are some patients who actually have done that, and they go into a little bit of withdrawal because these feel-good foods release endorphins, kind of like morphine kind of stuff in your brain. So I'm telling you, it's the real deal. And the other side of the coin is,
well, I certainly do have, I have some issues with wheat and just the genetically modified wheat products. And as, my bigger issues are with the sugarier things and high fructose corn syrup. I think that's a much bigger problem in our society. People always will say, geez, my grandfather used to eat like raw bacon sandwiches. He smoked a pack of Pall Malls and he lived to be 90 and he carried coal up both hills. And, those people, sans the smoking, I kind of agree. And that, we look back at that generation and what made them strong, what made them healthy. And I think part of it was diet, okay? There was no genetically modified stuff. I think part of it really has to do with sugar. The idea of like candy bars back in like the 40s and 50s, that was a huge treat. You didn't walk into a Turkey Hill and see just a mountain of high fructose corn syrup and sugar. We as a society consume way too much sugar, and I'm going to talk about that later on. There's headlines that say, all that sugar consumption actually increases cancer risk. For me, the other thing too is these people were a lot more active.
There's no doubt. And I think perhaps you should, since I didn't exercise, maybe you could dwell a little bit on exercise. Phil, of course, I'm very proud of him. He's involved with some CrossFitness. And tell us a little bit more about that, if you don't mind.
Well, I'm a member at CrossFit Drums, which is a gymnasium down here in the valley at Rittenhouse Plaza, where we do very specific types of classes, where we go over all different kinds of exercise, and a lot of it's fundamental body movements combined with Olympic lifting and conditioning. It's done at a high intensity level, so you get 20 minutes to an hour, depending on the class that we're doing, of some pretty functional movement, and you really get to move a lot. We don't go to the gym and sit there and watch each other lift weight and talk for an hour. You're moving, you're sweating, and for me, I think the exercise is key. You need good lean muscle, you need good cardiovascular output, and for me the best way to do that is these classes that we get a lot of different things. And so for me, my trainers have always told me I can't out-train a bad diet, and I've tried a few years to prove them wrong, and at the end of the day they're right. You cannot out-train a bad diet. And so for me, I have modified my diet much better since I started doing some CrossFit competitions, and I can see the difference. I'm getting bigger, I'm getting stronger, but I'm getting leaner, and I feel a lot healthier.
Well, then that's it. It's the best of both worlds. You combine diet with exercise, and it's a key to success.
Alrighty, so let's move on to some headlines. Cold turkey may be better for smoking cessation. They actually did studies that show, and I think this is true too, for patients that, as opposed to saying, I'm going to keep cutting down, keep cutting down, keep cutting down. How many times have people have cut their cigarette consumption in half each time they told me they did it? They'd be smoking like a micron of a cigarette, but they're still in the same pack to half a pack.
We prove this when we put patients in the hospital and they cold turkey.
Yeah,
because,
they often are able to quit.
They're often able to quit because they're off their smokes for a couple of days, since you can't smoke in the hospital.
Now, we talked about this briefly earlier, but this is something a little bit different. Too much sitting may shorten your life.
Well, that's why I stood up earlier. I'm going to lengthen my life by a few seconds. Well, there's no doubt we're a sedentary society. And you mentioned earlier these people who lived into their 90s. They had hard work, hard liquor, fast women, and they moved around a lot, let's face it. So that was one of the keys of success, is you got to move it or lose it.
This is one of the things I was reading about that really kind of shocked me, because I was surprised that in our industrialized society that our seniors have some of the poorest health in industrialized nations. Now, how is that possible? We have some of the best access to health care. We have preventative task forces that come up with all these recommendations. We work really hard to screen these patients, and yet we have some of the poorest health.
I'm not sure I can really explain it. What insight have you gained from that?
Well, I think it's a lot of things. They're really not necessarily sure why. Why, from a Medicare standpoint, there's a lot of guidelines in place for us to really try to track patients' health. And one of the people who wrote the article, the best way he described it was said, it really doesn't have to do with the seniors' health, it has to do with the gaps in their health care before they're seniors. These people work, drink, smoke, and eat poorly until they hit that finish line of retirement, and then they cross the line and they're half dead.
Right.
They have all this cardiovascular disease, they're diabetics, and they have all these problems. And so I would look at it almost as if from a senior health population, we're inheriting a lot of bad habits and bad disease state that naturally those things are going to get worse. They're not going to get better once you have these things.
So these people are sick when they retire.
Right.
Or they don't know it, but they're sick.
Yeah, they just have kind of not get their check. How many times do we see people who are 60-year-olds? I haven't been to a doctor in 20 years.
Yeah.
That's a problem.
And it goes back to what people take better care of their cars than themselves. I mean, let's face it, your car needs a yearly exam or it doesn't get passed. And we should really get inspection stickers annually for our health. So going on annual exams, one of the things we see, Phil, is people want to know what their cholesterol is. They're always concerned about that, particularly the LDL, which of course is the bad cholesterol. Rule of thumb was we want you at 100 or less. Mm-hmm. Greater than 100, you're going to get more plaque buildup. Less than 100, you won't. And if you get under 70, you can actually get regression of disease. I don't know if that's pretty much the same, but maybe you could tell us a little bit more about where we are with bad cholesterol.
That's the basic plot. The ultimate goal for people with absolutely no risk factors, less than 130. If you have a couple of risk factors, less than 100. If you have a lot of risk factors like a diabetic, stroke, heart attack history, then you got to get it less than 70. But they actually studied it to see, what's better? Is it better to get to that number, or is it better to reduce it a certain percentage? So they compared people who just got to their LDL goal versus, say, had a 50% reduction in their LDL. And what they found is that the group that had a higher percentage loss of LDL versus just a low number actually fared better, that they had decreased stroke and heart attack risk. And so, sometimes, especially for people with pretty high LDLs, you have an LDL of 200, I'm gonna have a hard time getting it down to less than 70.
Sure.
But if I get you down around 100, I've lowered your LDL 50% or greater. And that's gonna actually fare better than if I try to push you even lower. And this is all done, by the way, with a statin. That's the one salient feature on both sides of this argument, is that they didn't see a difference if we were, if we did this sans the statin. It really is important that we use these statins because, again, they play a role in inflammation, or I should say reducing inflammation. They play a role in plaque regression. They do so many different things. We've talked about it before. Other countries make them mandatory.
Yeah, when I have a headline here from Britain that says anyone over 50 should be on a statin. I know they're controversial, but I think they benefit far outweigh any potential risk.
For me, this is the year I turned 40, and I'm wondering, is this the time I should go on? I don't even know what my numbers are, but should I go on one?
You better get your inspection sticker. And speaking of inspection stickers, we're going to be right back after this brief commercial message. Remember, you're watching It's Your Health. We're your leader in healthcare information. We'll be right back. Welcome back to the third and final segment of It's Your Health. I told you it's the fastest half hour in
It's something
television.
about the HD. I think it makes it go faster. It's more surreal.
HD, right.
I can see the whole audience right in front of us. Going to the bathroom.
Let's go.
All right. Sugary drinks, bad carbs tied to cancer. Well, we talked about this earlier. They've actually done studies to show that things like breast cancer and prostate cancer have higher risks when people are consuming real high amounts of these bad carbs.
Yeah, and I think the label to avoid is high fructose or high corn syrup kind of stuff. Is that pretty accurate?
Absolutely. That's the sugar that I think is really bad. And there's a lot of money getting spent to prove that it's not bad by the corn growers of America and things like that. But at the end of the day, you can't let this stuff alone. This stuff, this is for real. We have an epidemic with sugar and diabetes. and it really links down to diet. These are preventable things.
You are what you eat.
There you go. Moderate alcohol consumption is not associated with reduced all-cause mortality.
That sounds good to me. Elaborate a little bit on this further.
Well, I mean, like a year ago, I said that if you drink alcohol, you'll live longer, and we've always kind of said that. And there's been a lot of studies out there that kind of did show that, moderate alcohol consumption, no more than 2 drinks a day. You can't bank them for the weekend like some of my friends do. They always would say, well, you're doing that, it can help extend your life. And if you go over 2, it's bad. Well, they really looked at the studies more intently and saw that it didn't really do anything. It didn't hurt you at 2 drinks and under, but it didn't help you as much as we thought it did.
Right.
And so if you're having that second glass of wine because your doctor said, maybe not so much. It's something to think about.
And when I do my nursing home rounds and I see old people who are, in relatively good shape at age 90, I've made it a point over the years to ask them, how did you do this? And believe it or not, one of the common denominators is they said, I drank every day. Now, they didn't get drunk every day, but they had a glass of wine or a brandy or something, a sip of scotch. So there may be something about that cleaning the pipes, not sure.
All righty. Lastly, this is interesting because I think it was something that you touch on, and certainly in our nursing home population, you screen for this heavily. Subclinical thyroid disease and mortality in the elderly are linked.
Yeah, we're in a thyroid belt, believe it or not, and if we look really closely, almost 1 out of 10 people out there have a thyroid disorder, and of course can run in families, so that your family history is important. But you should really have your doctor screen for a low thyroid state, and the constellation of symptoms that it can cause go from soup to nuts, from depressive symptoms to weight gain to high cholesterol. So I'd like to kind of make sure that that's part of your healthcare screening, thyroid screening. You'd be surprised how many times we've found patients, believe it or not, who actually came to us with what we thought was a dementing illness. The family came in and said, mom or dad isn't thinking quite clearly. They're having memory issues. And, before we started treating Alzheimer's, they had a low thyroid state, completely reversible, by the way. So it's very, very important.
I think it's really interesting because I think it's interesting too. We have people who've kind of like trounced their way through the healthcare system. They've been in the hospital, they've been here, they've been there, and we pick them up in the nursing home as a first-time patient. And what's the 2 things we find? Their thyroid's off and untreated, and their B12 levels off.
B12 levels.
These are both very reversible things for a lot of age-related confusion.
Very common.
All righty. Now, in the advent of some of the newer medications out there, like Eliquis and Pradaxa, these are the new blood thinners that are kind of taking place of Coumadin. They've actually studied DVT treatment at home. What was the standard treatment we treated DVTs, say, 5 years ago? What did we have to do?
You have a blood clot in your leg. We hospitalize you. We put you on intravenous heparin for 5 days until Coumadin, which you take orally, takes effect. It takes a good 5 days. And then you end up going home having to have blood tests every couple of days, every week, and every month, watching this Coumadin. Of course, you can't eat green leafy vegetables. You shouldn't drink on Coumadin. It was restrictive and cumbersome, and now it is.
Well, it's what we had, and so it worked well, and we still use it from time to time. But now with the newer medications, I can look at someone's leg, and if they're under the age of 50 and they really don't have any medical problems that are significant, I can say, boy, that looks like you might have a blood clot. I can give them a sample of something and say, hold on to this until I call you. And we send them for a Doppler, and let's say it's positive for a DVT. We start the medication right then and there. We don't need to monitor. We don't need to worry about levels. The safety is a lot better because it can work almost instantaneously. Yep. And it gets out of your system very quickly too, whereas Coumadin, if it gets a little higher, you start bleeding from it, it's kind of a pain to reverse it. Again, that's going to the hospital, it's getting infusions, it's a big morass. Whereas with some of the newer agents, I think they make it simpler.
So you avoid the hospitalization completely. You take the pill, go home, and the clot dissolves. It's revolutionary.
Yeah, it's really helped things. It helped things out. I know in the beginning when they first came out, I'm
an old school guy there, Phil.
All right. Well, I know that's fine. Should you stop drinking? We've spent a lot of time talking about booze, and I don't know if it's the post-Lenten sacrifice now that we're...
There we go, rejoicing.
So this guy in college who was a six-pack-a-day guy, just got used to drinking his six-pack every day, said to himself in January, you know what, I'm going to go ahead and stop drinking for 2 months and see how I feel. And he was really surprised by how better he felt. It's not that he felt he had a drinking problem, but he felt that he was healthier, he was more attentive, he wasn't as tired, he was more active, he lost weight. Alcohol has a lot of calories in it. A glass of wine has 200-300 calories. If you have a glass of wine every night, that's almost a pound of calories that you're consuming, at the end of the week. And I think one thing that was interesting about this is then, it's not like the guy quit drinking forever, but it gave him a new respect for alcohol, that he enjoyed it a little bit more when he had it in moderation, as opposed to just being, this is how I end my day.
I come back, exactly. Well, two things about alcohol which are interesting. It has more calories than candy, believe it or not. And secondly, and most importantly, the chemical structure of alcohol is only one hydrogen atom off from ether. Now, what does ether do? Ether puts you to sleep. It's an anesthetic. So you can see how there is a draw, if you will, towards that kind of thing. And I think everything in moderation. I'm kind of a eat, drink, and be merry kind of guy. That's how I've kind of gone through life. In a more serious note, we sign 3 death certificates a week in this office. 3 a week. That's our average. So we are here for a visit. So make your visit as best you can, affect as many lives as you can, eat, drink, and be merry. I think sometimes we get caught up in too many do's and don'ts in life. And so maybe that's the way we'll end our show today. What do you think?
Except for all the do's and don'ts we just went over. Those are the important ones.
I told you, don't do any of the things we talk about here on It's Your Health. But it's been a pleasure and a privilege to come into your home, hopefully to entertain and inform you. Remember, you're watching It's Your Health on Samsung Productions, your leader in healthcare information in HD, right?
That's right.
Okay, thanks for joining.